So to begin with, Dr. Cherise, could you talk to us a little bit about the impact that anxiety and stress of the veterinarians or any other kinds of pet professionals, wellness professionals that you're working with has on not only your animals, but on you if you're taking your animals to see them?
It's a great place to start. I think that in general, the biggest level of impact is burnout. That's the worst case scenario other than suicide of these veterinary professionals, right? The true burnout in that they're no longer able to actually provide care, no longer able to do their calling of caring for these animals that we love so much. The ultimate impact outside of that, you also start to see really great, compassionate veterinary professionals leaving the industry altogether and going to work in nursing or becoming an elementary school teacher or something different in order to be able to honestly try and right size and handle their anxiety. So it really does just mean nobody's getting the care that they need.
For veterinarians that or other pet wellness people that are still working but might not have burnt out completely, might not have left the profession yet, but they're working in a state of chronic anxiety and stress, how do you think that affects their ability to care for and connect with the animals and people that they're looking after?
Yeah, we use the term a lot of compassion fatigue, right? Where basically your body and your mental state is always in fight or flight. So you're always using that sympathetic tone. You're always looking for the next bad thing to happen or the next thing that's going to trigger you. And so really what starts to happen is you lose that connectivity. You lose the ability to appreciate the nuance of going from a puppy room to a senior pet care room to an end of life room. And it really does, it starts to, the defense mechanism is that you blunt how involved or how much of yourself you give to those interactions. And so it really does mean you can not only miss things, not ask questions that you meant to ask, or even in the worst case scenarios there, not having full therapy because your mind is elsewhere.
Do you think that the animals can feel that sense of stress in the professionals when they come into the room?
100%. I think it is something that we talk about it at home, right? Even with our own pets, that they can tell when you've had a bad day. They come and they snuggle up to you. They release that oxytocin for you so that you can get those moments of peace. But the opposite is also true. So bringing that energy of, oh crap, what's going to happen in here next, really does also push that energy into the pet, because then they become unsure. Is this a situation where I'm safe? Because I can't really tell right now based on the honestly, it's the nonverbal cues that come off. It's the difference from walking into a room with a tiny fluffy puppy to, 165-pound Great Pyrenees or a German Shepherd with a muzzle on, right? That your body language and how you're feeling about the room, what could be happening there, all absolutely pushes into that pet. Absolutely.
Okay, so what do you think is kind of like the average state of being of most, particularly veterinarians, but we're also talking about physios and rehabbers and vet nurses and even groomers and trainers, everyone in the industry is under pressure. What do you think the sort of average state of their mental well-being, overall health and anxiety is these days?
The best way I can put it is scattered. Know that we have an issue. We know that there are more pets than ever, and we know that there's proportionately really not enough professionals to care for these pets. And so really what we're struggling with is, how do we stop the rock from rolling downhill? How do we stop the issues that are happening while still being able to keep the wheels in motion, right? And so I really think that there's a lot of deliberation on what that needs to look like. Is it instituting, especially in the US, real-time off policies? Is it allowing for there to be more financial compensation so that you don't have to work many jobs, especially, our groomers, our rehabbers, our physios? They're often not making enough. They're not earning a living wage, whether or not they're a licensed nurse or any of those sorts of things along with it. So it's usually that these people in the veterinary profession are giving of themselves so much that in order to make ends meet, they have to continue to burn candles at multiple ends. And so we're scattered. The approaches are varied depending on who you talk to. And honestly, even the realization that there's a problem, depending on what regulators you're speaking to, there seems to be a disagreement as to whether or not there's actually an issue at all, which is the scariest part about it.
Oh, bureaucracy. Don't we love bureaucracy? Dr. Charisse, you've worked as a veterinarian in a range of different clinical settings. I'm working at the moment. And wow, this week we've got 2 nurses out with COVID. We've been down 3 vets from our ideal for probably 6 to 9 months. And everyone is just so stretched in the profession. And I suppose, how does this negatively affect the service and care that the industry, the pet wellness and veterinary industry is providing to all these people who are concerned? They might be coming in with a pet that they've got serious health concerns about. And a lot of people don't realize, I don't think, just how thinly stretched the veterinary industry is. How is this affecting the experience of the people bringing their animals in, do you think?
Yeah, I love this question because before I became a veterinarian, I was a biochemist. And so I love being able to take a step back outside of the medicine, outside of the personalities, and really see what's going on at a chemical level. When we talk about the level of stress and anxiety that veterinary professionals have to deal with, there are real physiological consequences, right? We have our stress hormones that go up. So those are your cortisol, raises your blood pressure, all of those sorts of things. And with that increase in cortisol, you also get decreases in the immune system. So you do actually get people that can't come to work because they're sicker. They just get sick more, especially in a pandemic, right? We know that we have opened ourselves up because of this level of stress, that our immune system can't operate the way that it normally should to be able to protect us. So what you see is a decrease in availability. I love to remind people, I was working relief, especially during the hot parts of the pandemic, because I understood what was going on. We get sick too. We get sick. We have families that we have to take care of that also get sick. And so what the pet parents see is a decrease in availability for care for their animal.
And what happens is a lot of people get upset about the decrease in availability and then dump on the vet team and the nurse team. And that makes the problem even worse, right?
It does. And so that was actually my very next bullet point, is that this directly impacts our bond with our veterinary clients, our pet parents, our pet families that we serve. You know what? Dr. Roth, Dr. Charisse isn't in today because she's sick. And what that translates to is your pet can't get care today. I am a pet parent. I have 6 dogs. I have lots of critters all over the property. There's a moment that you just feel let down as a pet parent because we are one of the most reliable professions. We will always find a way to be there. And in these particular cases, we've started to falter there pretty significantly. And so it absolutely impacts our bonds with teams. You're seeing lifelong clients from clinics leave to go to another one because they can't get in. Not being able to get in adds to the pet parents' anxiety of, how do I get care? I love this little critter so much. How do I get him what he needs? And what it shows up as in the minds of the pet parents often is, Dr. Charisse doesn't care. My doctor doesn't care. She's not there. And that's where it seems and it feels like, rightfully so, a lack of compassion. When we know that people that care for animals, people that care for pets, are some of the most giving of ourselves, most compassionate. And that I love to define what I mean by compassion. Compassion is love in action. So it's not enough to just love a pet. Right? We have taken it the step further of, we put our love into action. That is, we will prescribe for you. We will treat your pet. And if it needs it, we will also euthanize that pet, because that is our love in action for that animal. And so that lack of action makes it feel like there is not compassion there.
Yeah. And the other big one that I see a lot on social media, and I get come at me at work too, is, you vets are only in it for the money. Which is another stress, because it is expensive to have veterinary care, and people don't realize how expensive it is to run a veterinary hospital either.
That's right.
The overheads are phenomenal.
It is. And, I think that we have to do a better job as veterinary professionals of being transparent about that. We show the financial stress is important by doing things for free or sliding things in on the treatment plan and not charging for it appropriately, where what that actually does is it's not giving a clear picture of what that veterinary team or those veterinary professionals is actually doing for your pet and the actual worth of it, the value of it. And so we've now we've trained pet families, animal owners, to equate the size of the bill with the value you've provided. And we know that those don't always match up.
No, medicine doesn't work like that.
Exactly. But we as the professionals haven't done a great job of saying, the things that we do, the knowledge that we have, it does cost money. We're blinded here in the US from a lot of that because of the way the health insurance game has been played here for humans. And so it's jarring for a person to go, I don't have to pay for my vaccines. Why do I have to pay for my dog's vaccines? Right?
Oh, wow.